Communication is the exchange of information. This can be done verbal in a spoken or a written manner, or nonverbal through body language, facial expressions, or touch. When you're speaking with someone, there are certain types of questions that you might want to ask. So like direct questions are yes or no answers. And then there's open-ended questions, and that encourages conversations. So if you're wanting to have a conversation with somebody and you say, did you like breakfast today? Yes, no, and the conversation ends. But if you say, what was your favorite part about breakfast today? And they say, oh, I loved the bacon. And then you can go on to say, oh, do you like your bacon crispy or do you like it softer? Bacon's my favorite part too. I really like strawberry jam, blah, blah, blah. You know, you carry on in that way. It's an open-ended, it encourages the conversation. So keep that in mind when you're communicating. If you're wanting to encourage conversation, don't ask yes, no questions. When it comes to communication on the telephone, it's important to identify yourself and your title. You want to make sure that you're nice and polite and you speak clearly. And then when you're taking a message, that you are writing a clear and accurate message. All right, so a nursing assistant may give or take which information over the phone? A, report of resident's condition. B, physician orders. C, results of laboratory tests. Or D, name of person leaving a message. And the correct answer is D, name of person leaving a message. So know what your role is, the scope of practice for a CNA. You should not be taking physician orders or reporting on a resident's condition. You shouldn't be doing anything like that. But you can take a message and have the nurse call them back. Dementia. When we're communicating with someone with dementia, we have to remember that there's a loss of cognitive function, and it interferes with the person's personal activities, social activities, and occupational activities. And so these are things that we have to keep in mind as we're trying to communicate with them. Cognitive function is memory, thinking, reasoning, ability to understand, judgment, and behavior. So going back to the definition of dementia, dementia is the loss of cognitive function, memory, thinking, reasoning, ability to understand, judgment, and behavior that interferes with personal activities, social activities, or occupational activities. So it's good to understand what dementia is, because you will definitely deal with dementia patients. So let's talk about some barriers to communication. If the resident has impaired hearing, it's going to be very important that you speak where they can see your lips, because often they will rely on lip reading, that you don't stand on the side where they have the impaired hearing if one side is worse than the other. If they have difficulty understanding, that may be a barrier to communication. If they speak a different language, that can be a barrier to communication. So you'll have to find ways to overcome that. Barriers to communication for the CNA. Asking a why question, your body language. If you stand with your hands on your hips or your arms crossed, that's giving off a certain nonverbal message to them that maybe you're not interested in what they have to say. Asking yes/no questions, because remember, that doesn't encourage conversation. Slang or profanity. Many times the elderly don't understand today's slang, and some people are really turned off by profanity. Watch the cliches. Oh, everything will be okay. That kind of stuff. That's not helpful. Let's see. We're going to skip over that. Acceptable touch. Remember that if the resident asks for a hug, that's okay. Holding a resident's hand when they ask you to, that would be okay. When you're touching a resident as you're bathing them, dressing them, feeding, shaving, that's all acceptable, okay? You shouldn't be kissing your residents or if they're pulling away from you and you're hugging them against their will, or if you're rubbing your body up against them, or sitting in their lap, or them sitting in your lap, those are all inappropriate things. So touching a resident can be a successful method of communication if A, you ask the family's permission, B, are not offended by touch, C, are gentle and caring, or D, always grasp the resident firmly. What do you feel like is the best answer? The best answer is are gentle and caring. So communication challenges. If they are visually impaired, use the face of a clock to explain positions of the objects. So if they are blind or have visual impairment, you can say, okay, you're in your room and the bathroom is at 3 o'clock. Your sink is at 9 o'clock. And your bed is at 12 o'clock. And that would explain, the bathroom's to the right, the sink's to the left, and the bed is straight ahead. Hearing impairment, if they do have a hearing impairment, try to use a lower pitch of the voice, because that is typically they can hear that better than the higher pitches, which are usually lost first. The resident should be able to see your face, which we already talked about. And then if they have anxiety or fear, touch is an appropriate method if they are agreeable to that. If they're angry or combative, remember to stay calm. If you're hyped up or excited, that's going to make the matter worse. Confusion, if they're confused, a quiet environment might be helpful. If they're comatose, remember they can still hear you even if they're not responsive. So continue to explain what you're doing, talk to them. If they have an artificial airway, so like they're on a ventilator, writing notes or using a communication board can be helpful. There is a video that I posted in the video segment, and it's on professional boundaries. I highly recommend that you watch that video. Talks about limits to relationships with residents and families. Very common for us to cross those boundaries sometimes, so you want to watch that.